Hi, welcome to the third trimester prenatal class. We're so glad that you're here with us today. We're going to discuss several things that are pertinent to the third trimester. During today's class, we're going to discuss the following: common third trimester complaints, kick counts for your baby, a packing list for the hospital, labor and delivery, breastfeeding, postpartum care, safe sleeping, and some family planning. As you likely already know, during the third trimester, your body changes a lot. Your baby's growing significantly from about 1 pound at 20 weeks to at 40 weeks, about 6 to 8 pounds. That's a lot of changes. Because your belly is getting bigger, your baby's growing, you're getting more amniotic fluid, and your uterus grows. That changes a lot of the normal, not only anatomy, but physiology of your body. What that means is it changes the way that your body normally works, which is okay, but it can cause many discomforts, and it's good to know what to expect and how to troubleshoot these things. Some common third trimester complaints include heartburn, back discomfort, pelvic discomfort, constipation, difficulty sleeping, Braxton Hicks contractions, and swelling. We want to talk to you today about each of these things, what you can do at home to try to minimize these discomforts, and things to watch out for, like when you need to call your doctor or come into the office or the hospital for further evaluation. We hope this information is helpful so you know what to expect. Acid reflux is extremely common during pregnancy. As many as 50% of women will experience this. If you have this, you may notice burning in the chest or throat, stomach pain, frequent burping, sensation of food coming up, dry cough at night, nausea in the morning, and a bad taste in your mouth. Once food enters the stomach from the esophagus tightens to prevent backflow. However, in pregnancy, there are a lot of hormonal changes which makes the esophagus more relaxed, allowing the stomach acid to come back up more easily. Also, as the uterus gets bigger, it pushes up on the stomach, making the reflux easier to happen and harder for the stomach to empty in its normal way. The picture here shows you these changes. Acid reflux, especially during pregnancy, can be quite uncomfortable. Unfortunately, there's not a lot that we can do to change the fact that your hormones are changing, which makes this easier to occur, or the fact that your uterus is getting bigger and pushing up on your stomach. However, there's lots of tips and tricks at home for helping making the acid reflux less uncomfortable and more manageable. Try to avoid triggering foods. Traditionally, foods that trigger acid reflux are spicy, greasy, and fried foods. It is much better to eat small, frequent meals so that the stomach does not get as full. Stay very well hydrated, primarily drinking lots of water. It is also important to remain upright after you eat to allow everything to digest, because when you lay down, it makes the acid reflux more likely to occur. Ask your doctor about safe medications that you can take in pregnancy if you're still having some of these symptoms. Another very common symptom of pregnancy is back pain. Back pain is commonly in the mid to low back. As you can see on the picture, the woman on the left is about 12 weeks pregnant. The curvature of her spine at this time is fairly normal. As her pregnancy progresses, the uterus and the baby grow, which puts more and more strain on the low back. You can see on the right that the curvature is much more pronounced in this picture. This puts more pressure, strain, and causes discomfort in the back. Also, those same Hormones that relax your GI tract during pregnancy also relax your joints and ligaments. This is because your body is preparing to be able to push your baby out through your pelvis. Because of these changes, this also can contribute to the discomfort. There are many different options to help alleviate low back pain in pregnancy. One of the best things that you can do for your back is some gentle exercising and stretching. Specifically during pregnancy, it's important to strengthen your core because that helps stabilize your spine and improve pelvic floor muscles. This can be accomplished by exercises that gently stretch your low back, torso, and pelvic floor. Prenatal yoga is a very safe way to do this. You can start by trying it a few minutes each day and work up from there. There are lots of resources online that show gentle pregnancy-related stretches and yoga. Some women choose to get massages from prenatal therapists during pregnancy. In general, this is considered safe. They can alleviate tight muscles through massage. Something else you can try is heat or cold on your low back or hips. You should avoid heat applied directly to your uterus, but 20 minutes of heat on your back or your hips is considered safe. Just make sure that whatever you're using is not too cold or not too hot to help prevent damage to your skin, and only leave it on for 20 minutes at a time. Changing the position you sleep in can also help alleviate back pain. During pregnancy, you should avoid lifting heavy objects. It is recommended not to lift anything more than about 20 pounds. And always remember to keep proper form. Squat down, bend at your knees, and keep your back straight. Pictured on the right is another thing that you can use to help low back pain. This is a pregnancy support belt. You can find these online or over the counter. You can also ask your doctor for a prescription. These work by helping lift some of the weight of your uterus off your pelvis and low back and just provide overall more support. These work well for some women, but not for everybody. This is something you could talk to your doctor about. There's also safe medications to take in pregnancy for pain relief. This is something that you should talk to your doctor about. But in general, as long as you don't have any other health concerns that would prevent you from taking Tylenol, Tylenol is considered safe in pregnancy. You do want to avoid all non-steroidal anti-inflammatory medications. These medications are ibuprofen, Aleve, naproxen. These are not safe in pregnancy. Pelvic discomfort is also very common in pregnancy. One of the main reasons for pelvic discomfort is round ligament pain. Round ligament pain is a common painful sensation that women feel in their lower abdomen or groin in the second and third trimester. Round ligaments support the uterus and connect the uterus to the front side of the abdominal wall. It might be more noticeable when you get up from a sitting or standing position, or if you sneeze, laugh, or cough. Round ligament pain is common and generally not something to worry about. However, you should discuss pain with your doctor to make sure what you're feeling is not something else. Ways to help round ligament pain are similar to ways you can help your low back pain. As you can see, using a heating pad, as long as you're not placing the heating pad on your uterus itself, more in the groin area, taking warm baths, performing gentle stretches, wearing a pregnancy or maternity belt, or trialing safe over-the-counter pain relief after you've talked to your doctor about it are all things you can try for round ligament pain. As I said before, if the pain is concerning to you, you should discuss this with your doctor to make sure there's nothing else that's going on. Constipation is also extremely common in pregnancy. As your baby grows, your uterus puts more pressure on many places in your abdomen, not only pushing up on your diaphragm like we discussed before and causing more reflux, but it also pushes on your colon and your small intestines, and it makes it more likely to become constipated. Also, those same hormonal changes relax your entire GI tract, including the bowel, and so they slow down digestion from start to end. Supplements like prenatal vitamins that contain iron, which are good in pregnancy, can also make constipation worse. If you're starting to have problems with constipation, we recommend you talk to your doctor about different options, as straining and pain with bowel movements can get only worse the longer you are backed up and constipated. You should try to eat plenty of fruits and vegetables. Stay really hydrated. But there are also many safe medications to help with constipation in pregnancy. Miralax is one of many physicians' favorite go-to for constipation in general, but also constipation in pregnancy. This is a powder that you can put in your water and it dissolves and it helps with your bowel movements. It is not absorbed systemically, and so there are no side effects to you or your baby. In general, the Miralax can take some time to work, and dosing can be varied from person to person. We always recommend talking to your doctor before you're starting a medication in pregnancy, but Miralax is a good option. It is common for sleep in pregnancy to become difficult. There's many different reasons for this, including some of the things we've discussed before. But in the third trimester, it's common for women in general just to become more uncomfortable. They have acid reflux, they can have back pain, leg cramps, have to urinate frequently in the night, might snore when they otherwise wouldn't, and this can all affect sleep. Some of the most important things you can do for your sleep is kind of just generalized what we call sleep hygiene. So when you don't sleep well at night, you can become obviously more tired and drowsy during the day, and that might lead to increased desire to sleep during the day, like naps. But if you're really struggling to sleep at night, you should try to stay active during the day so you are more tired and are able to sleep at night instead of during the day to keep kind of a normal cycle. You also can help your sleep by doing a few simple things. Keeping your room dark and cool, getting the necessary pillows and setup to alleviate some of those discomforts, not spending excessive time in bed if you're not sleeping, avoiding screens, noise, stimulation about 30 minutes to an hour before bed. These are all sleep hygiene practices that we recommend for everyone. If you're snoring a lot and really struggling to sleep, we recommend that you talk to your doctor about this. We recommend you would talk to your doctor before starting a sleep aid in pregnancy to ensure it's safe for you and your baby. This picture is a good demonstration of some of the best sleep hygiene practices, many of which I discussed in the previous slide, but this is a great summary. It's best if you go to sleep and wake up the same time every day, even on the weekends or on days you might have less scheduled. It can be helpful to kind of meditate or do some relaxing mind activities for 10 plus minutes prior to bed. Try to create a bedtime routine. This might be getting your kids to sleep and then taking a warm bath or shower. Turn off your devices, including your phone, TV, iPads, etc., at least an hour before going to sleep. Even if you don't feel like this stimulates your brain, the bright lights is very stimulating and it can make it difficult to sleep. Try to avoid caffeine and other stimulants after lunch. Keep your room nice and cool. Make your room as dark as possible. Get enough exercise throughout the day so you're more tired at night, and avoid large meals close to bed. Water retention is extremely common in pregnancy and worsens as you get further along. This can be uncomfortable and can be more exaggerated when you're on your feet for long periods of time. While it is safe to be on your feet during pregnancy, and we would not recommend bed rest for this, it is good to take frequent breaks and keep your legs elevated when you can. You can also try support and compression stockings and sleeping on your left side at night. If you notice that the leg swelling is more pronounced in one leg or associated with other symptoms like redness, significant pain, or shortness of breath, make sure you let your doctor know. Next, we're going to talk about kick counts. Your baby's movement is a sign of your baby's well-being. Your baby's movement is going to vary depending on the time of day, how many weeks you are, and your baby's sleep and wake cycle. There's lots of different ways to keep track of kick counts. Starting the third trimester at 28 weeks of pregnancy is when we recommend you start actually counting. Most physicians recommend that you count to 10 in the third trimester. This means that you should feel your baby move 10 times within 2 hours. It's best to count when you know your baby's going to be most active. One way to do this is to sit comfortably or lie on your side. Record the time of your baby's first movement. Count until you get 10 movements. If you feel the baby move 10 times within 2 hours, that is reassuring. If at any time you're concerned about your baby not moving, you should call and talk to your doctor right away. If you don't feel your baby moving like normal, we recommend you drink something cold or sugary. This can help wake your baby up if your baby's just sleeping. Like I said before, then we want you to sit in a quiet space and really focus on fetal movement. The movement does not have to be a big kick. Any movement counts. If you do not get the 10 kicks in 2 hours, again, we recommend that you call your doctor or go into OB triage to ensure that your baby is okay. Once you reach the 3rd trimester, it's good to start planning ahead for the hospital. One of the things on the to-do list is packing for the hospital. There is no absolute perfect list for packing for the hospital. What I mean is what you might need might be different from what the woman next to you needs, and that's okay. Some things I would highlight would be some comfortable clothes for you and an outfit to go home in. Some personal toiletries that you don't want to go without would also be a good idea. Maybe your contacts or glasses, things like that. Also, your significant other or your support person who's going to be spending some time in the hospital with you might need some things as well. For example, a change of clothes and their own personal toiletries and maybe their phone, chargers, things like that. It's always good to bring in your driver's license and your insurance card, a list of your daily prescriptions if you don't already know them. Things that are important for baby would be a car seat. Baby can't go home unless you have a car seat for baby. There'll be plenty of diapers and things like that stocked at the hospital. But if you want your own personal outfit to take baby home in or outfits for the baby while you're in the hospital, it would be a good idea to bring those. The other things on this list are just here for your reference. There's lots of different lists available online. I would recommend not overpacking, but bringing just some essentials. Some women ask me in the office about what they should bring for their perinatal care afterwards, like postpartum undies, pads, creams, things like that. And the nurses will help you with that and are well stocked in the hospital. You might just want to have some things stocked at home for when you get home, but otherwise, all your medications and anything medical that you need while you're in the hospital is going to be provided for you. Next, we are going to discuss labor. Each woman's experience is going to be different, but we will highlight some of the common things that is good to know ahead of time. It's very common for first-time moms, and even all women, to struggle when to identify true labor has set in versus Braxton Hicks, or those practice contractions that aren't true labor. Signs of true labor are going to be regular contractions that occur every 3 to 5 minutes, which are strong enough to cause discomfort, and that goes on for at least an hour. We talk about commonly the 5-1-1 rule. So when you start to experience contractions that are timeable every 5 minutes, and that continues on for at least an hour, it's time to come into triage. The other one stands for 1 minute. Typically, contractions are going to last about 1 minute when they're very strong and significant enough to make cervical change. This can be hard because Braxton Hicks contractions, which is the lay term for practice contractions, can also be very uncomfortable. And there's really no way to know at home if you're in true labor or not. And that's what we're here for. So the things for you to watch out for are the things I've discussed: regular painful contractions, contractions that last 1 minute, occur every 5 minutes, and that pattern goes on for an hour. Then it's time to come into the hospital and be evaluated. During labor, there are many pain management options. Having a really good support person or a doula can be very, very helpful. There are IV pain medication options, and another option is an epidural. An epidural is a procedure that is done by an anesthesiologist in the hospital. Once a woman is in true labor, where their cervix is making change, as long as there's no contraindications or reasons why it's not safe for a woman to get an epidural, then an anesthesiologist can come in and talk to you. They'll go over this procedure with you at the time of delivery, or the time of the epidural placement rather. They'll discuss what this process looks like in detail and answer any questions for you. But essentially, this procedure is where they put cleaning soap on your back, they numb you up, and then they insert a catheter into a very specific space, the epidural space in your back, so they can administer continuous pain medication. This can help alleviate the severe pain during labor. It's common for labor to progress in a certain pattern. This isn't something for you to worry about, but this is something that your OB provider is going to be checking on and ensuring that this happens. So once your cervix starts dilating, we anticipate that it's going to continue to dilate and thin out until you reach 10 centimeters. 10 centimeters is when the cervix is completely gone, and typically at this point, or in the near future, is when it's ready to start pushing. There are reasons sometimes that labor does not progress as we expect. This is something we can't always predict, but it is something that we monitor closely for, and we would have ongoing discussions with you during the time if we foresee any issues with this for you. Once you reach 10 centimeters, the nurse or your OB provider might start pushing with you. They're going to teach you exactly how to do this. We don't expect anybody to come in and know how to birth a baby, but you all each have the capability of doing this. We'll give you instruction and we'll be right there to support you. We expect each of you to have lots of questions about labor and delivery. This is a really good opportunity to pause and to ask your questions. One thing to keep in mind is nursing is really great, and they're going to be there for you throughout this whole process. Also, we hope this conversation sparks some points in which you can go back to your OB provider and process and talk to them about as you are preparing. After your baby has arrived, one of the first things that's on the to-do list is feeding your baby. The nurses are going to be there to help you. Feeding your baby might look different from somebody else feeding their baby, and that's okay. We're here to provide more information on breastfeeding and different ways you can feed your baby. I would like to provide a little bit more information on breastfeeding. However, I do recognize that breastfeeding is not right for everybody, and that's okay. Human milk is recognized as the optimal food for all infants. Mature milk takes 2 to 5 days to come in for most women. However, before this, the breast produces a substance called colostrum. This is a clear, yellow, straw-like liquid that has dense nutrition for your baby. The labor and delivery nurses, the postpartum nurses, have a really great base knowledge for helping initiate breastfeeding soon after birth. The goal is for the baby to be on the breast within the first hour of life. Also, at the hospital, it's common for there to be lactation nurses who are available to teach you how to do this more effectively, to answer your questions, and to troubleshoot with you if things aren't going as you would expect. Stimulation of the breast or demanding feeds is what allows for enough milk to supply. What this means is the more your baby feeds, or the more you maybe pump, this is going to promote the supply of your breast milk. There is a whole breastfeeding course or class that is also available to you, and that information can be provided. Next, we're going to talk about how to keep your baby safe while sleeping. Safe sleep is very important for your little one. Unfortunately, about 3,500 infants die a year in the United States as a result of co-sleeping or a sleep-related accident with an infant. Please keep your baby protected when they sleep. The best way for your child to sleep is on their back. The baby should sleep on a firm surface all alone. Your baby should not have any loose blankets, pillows, bumper pads, stuffed toys in their crib with them when they sleep. You can definitely have your baby sleep in your room, but they need to be in their own bed. After you deliver your baby, you have now entered a postpartum state. There's many changes that your body goes through, both physically and emotionally, after your little one has arrived. We want to discuss some of the common postpartum things to expect to help this be a smoother transition for you. After you deliver your baby, your doctor or OB provider will monitor you in the hospital for the next 24 to 72 hours, most commonly, depending on what your mode of delivery was and how your postpartum course is going. Now, of course, as complications arise, this could change this, but for typical postpartum care, women are in the hospital for about 1 to 3 days. Your baby will stay in the room with you the whole time unless they need certain particular medical treatments, and that of course would be communicated with you before the baby is moved. The nurses are going to help you with breastfeeding, with your perineal care, which is kind of the term that we use for your vaginal care, your bottom care afterwards, for pain relief. They're going to give you pain medications. They're going to make sure that you are eating and drinking okay, that you are able to urinate and have a bowel movement or pass gas, that you're able to get up and walk around the room, that you're not having signs of any complications such as too much bleeding or too high of blood pressures and things like that. So they are monitoring several things, and that is communicated with your OB provider during your hospitalization. When it is safe for you and your baby to leave the hospital, you will be discharged home. There's different things that you should be monitoring at home, and it's important for you to know when to call your doctor or OB provider. After C-section and vaginal delivery, it's common for you to have vaginal bleeding. However, there is a range of normal, and if you are bleeding more than saturating a pad every hour, that is considered very heavy and you should call in. If you experience a fever, you should call in for that as well. If you're having worsening vaginal or uterine pain that's no longer controlled with the medications that were recommended to you, this is also important to let your provider know about this. Also, things to watch for are breast problems. If your breast becomes very red, very painful, or you're worried about a new mass or sore at your breast, please let your provider know. Things that are abnormal would be shortness of breath, chest pain, significant leg pain or swelling that's not symmetric. Also things to watch for are mood disturbances. So during pregnancy, your hormones run very high. After delivery, these hormones drop down significantly. This change in hormones can cause postpartum mood changes. Postpartum blues describes what is considered kind of a normal decrease in your normal mood. So this can last for up to 2 weeks, and you might just be a little bit more sad or not quite yourself. We generally consider these symptoms more mild, where you're still able to manage doing the things you need from day to day, still able to care for your baby, you're still finding happiness and joy in the days. If this becomes more severe though, or lasts longer than 2 weeks, those can be signs of postpartum depression and anxiety. Like I said before, this is very common, but this is not something that we want you to suffer with at all. We want you to be communicating signs or symptoms that you might be having with your provider. If you're feeling sad that's out of proportion, if you're crying a lot, you're not finding joy, you're so scared, you're having lots of guilt or significant fears for you or your baby, we want you to call in right away. If you're having thoughts of wanting to hurt yourself or others, including your baby, we want to help you. And this is very important for you to come back to the hospital immediately, where we can evaluate you, keep you and your baby safe, and get you the help that you need. Next, we will discuss family planning. After you have your baby, there is a lot on your plate, but family planning is something that we don't want to get brushed under the rug or forgotten about. We do recommend that you wait at least 12 months before getting pregnant again after having a baby because your body is healing. Ideally, waiting 18 to 24 months is the best recommendation. This is the best way to keep you safe and to optimize the chances of having a healthy pregnancy in the future. While we know birth control is not the best option for everyone, there are a lot of safe options for contraception after you deliver a baby. Make sure you talk to your doctor about this at your upcoming visits and at your postpartum visit for sure. Commonly, it is recommended that you avoid intercourse for the first 6 weeks after you have a baby. This is for several different reasons, but it's to help avoid any further injury as your body is healing up and to prevent infection. There's different birth control options that are considered safe right after delivery. Progesterone-only birth controls are in that category. Even if you are breastfeeding, progesterone-only contraception is considered safe. Progesterone-only birth control comes in different options. One option would be what we commonly call the mini pill. This is a progesterone-only pill that you take once a day. The Nexplanon, which is a small implant that goes right under your skin in your arm. The Depo-Provera shot, which is a progesterone-only shot that goes in your muscle. This can be done right at the time of delivery and lasts 90 days. After 6 weeks, all birth control options are considered safe for the general population. You might have another reason why estrogen or another commonly used birth control is not recommended for you, so this is very important to talk to your doctor about. This diagram on your screen shows you the type of birth control options and the ones that are the most effective and the ones that are the least effective. So the ones that are most effective, which is less than 1 in 100 pregnancies, so greater than 99% effective, is the Nexplanon, which is the implant in the arm, intrauterine devices, which are called different things, but some are progesterone only, and one is copper only, which is no hormones. And then permanent sterilization would be like a vasectomy or getting your tubes tied, which are procedures that can both be done in the postpartum course. It is important if you are wanting to have your tubes tied for permanent sterilization that you talk to your doctor about this in advance. If you have a vaginal delivery, you might be a candidate to have this procedure done the day after you have the baby. This is a procedure where they would go in through a small incision under your belly button while you're already in the hospital, and you would have one recovery period from the surgery and your postpartum recovery. This is not a good option for all women, and that's something that you would need to talk to your doctor about. Also, if you have a planned C-section or end up having a C-section and you want a tubal ligation, which is the medical term for getting your tubes tied, this is something that can easily be done at that time. However, sometimes, depending on your insurance, the appropriate forms need to be signed in advance. So it is important that during the 3rd trimester you talk to your doctor about this. It's also important to remember that getting your tubes tied is considered permanent and not reversible. And this is certainly not right for everybody. Below, in the green category, are ones that we consider okay. For perfect use of these, about 6 in 100 women, 6 to 9 in 100 women could get pregnant. So it's not as good as the category above, but they are considered pretty reliable. The pill is something that you would need to take every day. The patch and the ring are also good options, but these both have estrogen in them, and so they would not be recommended to start right after you have the baby. And again, like we talked about before, the shot, which is a progesterone-only shot, and this is something that you need only once every 90 days. Things that in general we know don't work as well are in the blue category. In the blue category, about 12 to 24 in 100 women get pregnant using these. These would be things like the withdrawal method, using condom or a diaphragm, or natural family planning or fertility awareness methods. All of these are options, and we want you to be aware of these so you can talk to your doctor about them. Thank you for coming today. Now we will open it up for questions. We appreciate your time and hope the class was helpful for you.